And then from the fascia, we want to move on to the meat and bones, which is literally the muscles and the functioning of where the bones literally sit. And function is very important in all of that, and the balance of that function. There's this whole principle where people are advised that if they're in pain to use less of their muscle, and I actually want to say that's the wrong way of going. It's the right use of the muscle and making that muscle strong in the right balance use. So it's proper function that actually in the long run will help for that pain, because we're getting back into the balance of those muscles and how they should be.
It's like when people have tightness in their glutes, they're very tight glutes, but they're actually weak glutes. So they're not doing their function, so it's the same up here. Yeah.
And it's just then other muscles have to overcompensate. And that's where the balance goes. Because you do have that weak core and it actually needs more. So Botox injections, muscle relaxants and staying away from those will only help you for short term.
Yeah.
And only in the acute situation, but in long term it actually works off.
Yeah, I call it the Band-Aid effect. So we put it on, we make it feel a little bit better, but then we don't actually address the root cause.
The meat and bones.
Before we do meat and bones, I just want to bring attention to something, and maybe the camera can pick this up, is that the two of us are sitting on our sitting bones, which is really important because a lot of people sort of sit back like this, and it plays a big role in with how your head aligns and how your breathing is affected. And
you, even in the surgery, I've got a special chair, a saddle chair,
yes,
to sit on the sit bones. So it keeps a better posture and a better balance.
Yeah. The base of the skull has these two little bumpy bits over here, and these are the two sort of balls that are going to sit into the socket of the very first vertebra, which is C1, or called the atlas, depends on how you know your anatomy, but it's the very first vertebra. And what's an interesting thing about this is that these two bones here are the same orientation as your sitting bones. So if you had to just drop the occipital bones straight down like that, they would rest in the same direction and right in between the two sit bones. So can you put your hands out like that? You'll be the sit bones, and then I would drop my occiput bones all the way through, and we would be a perfect match. And that's quite a nice way to then balance the head and the pelvis. I'd like to do a little exercise. You want to do it with me? All right, so we're going to take a seat on our sit bones, and we're going to rock our tail under, so we scoop there, and tilt our head backward.
The other way.
And then we're going to roll our head forward and rock our tail back. So now we're doing opposite things in our pelvis and in our head. It's not that easy. It's a bit of a coordination
it's like
exercise.
playing the piano.
But it's so good for our nervous system, because our nervous system is going, well, what is going on here? I can do that, but it doesn't necessarily feel the right way. And then just relax out of that. And what we're going to do is put a bit of weight onto the right occipital ball and the right sit bone. So we're going to tilt our head and feel more pressure in the right. And then we're going to do that to the left. Left sit bone, left occipital bone. And then again, just a slight weighting over from one side to the other. Little head turn, not too big, very small movement, as though you're just rocking the occipital bones in their little grooves. And then again, coming to balance. How do you feel? Ready for the next segment?
Yes.